Artificial intelligence is transforming industries every day, including the healthcare sector. There could come a day when AI is used to diagnose your illness, analyze your test results, develop drugs to treat you, and help your surgeon perform better in the operating room. But the quickly advancing technology comes with risk, along with those benefits. Joining us live to discuss is Dr. Suzie Bash, Neuroradiologist and Medical Director at RadNet. Good morning, Dr. Bash. How are you?
Good morning, Irene. I'm doing great. Thank you.
Great. Okay, so you use artificial intelligence at RadNet. How has this been helpful for you?
Yeah, so, really AI is transforming all aspects of healthcare, but most profoundly in technology-based subspecialties like radiology. So I work for RadNet, which is the largest outpatient imaging enterprise in the US, and we use a lot of AI tools to really improve patient care. So, for example, we use AI to allow us to scan patients 50 to 75% faster. And this is really important because about 30% of patients have a severe anxiety reaction when they go in the MRI scanner. So to be able to get them in and out faster is making a tremendous difference in these patients' lives. And it doesn't just allow us to go faster, but it also really significantly improves the image quality. And that essentially makes us better doctors. It means that we might be able to catch cancers when they're very small in size, or a brain aneurysm when it's small, when treatment is really most impactful. So that's an exciting application of AI that we use. But we also use AI to help with cancer detection. We do about 2 million mammograms a year, and we use AI on these mammograms. It allows us to detect breast cancer 1 to 2 years before even an expert radiologist. It really is tremendous technology. And obviously, the earlier you catch the cancer, the better the treatment options and the outcome for the patient. So it's very important. We also have AI tools in development to detect lung cancer and prostate cancer. And another area that we use AI is for the evaluation, the diagnosis, and follow-up of patients with dementia, like Alzheimer's disease. And that is really important because right now we now have the first disease-modifying therapy that has regulatory approval and insurance coverage. And so, 7 million Americans are suffering from Alzheimer's disease. In fact, 1 in 3 of our Americans will die with dementia. And so this AI technology is very useful, and we also have products in development that can actually detect the side effects from this new medication. And we use AI to evaluate patients with multiple sclerosis and other diseases as well. So it is really a very, very useful tool, and we do employ that at RadNet. And again, it's all about the patient. It's really making a tremendous difference in their lives.
And you talked about a number of different illnesses and diseases there. It's one thing for an AI chatbot to give maybe wrong answers. It's another when an incorrect output impacts your health. Is there a way to defend against making dangerous mistakes when using artificial intelligence?
Yes, and so the kinds of AI that I'm talking about are not so much generative AI, where like chat box type AI. These are other more specific applications in healthcare. But you bring up an excellent point because theoretically bias can be introduced when you train these AI algorithms. So I'm a very, very big believer in clinical validation trials. I participate in those and I publish in those, and they should be multi-center, multi-reader trials at multiple different hospitals, so that we can make sure that the AI algorithm can be applied across the board and it's delivering what the vendors say it's going to deliver. So again, I'm a big believer in that. And there is skepticism about AI in other areas, but in healthcare, I have seen a very, very positive benefit. And one of the big things that we haven't talked about yet is the ability of AI to detect urgent and critical findings on imaging exams. So AI, for example, can detect brain bleeds or early brain aneurysms or cervical spine fractures, or critical narrowing of the coronary arteries to the heart. Heart disease is the #1 killer. Can also detect blood clots in the lung, which we call pulmonary embolism, or aortic aneurysms. And importantly, it can be used to detect stroke early. In fact, 1,500 hospitals in the US are employing AI for stroke detection. And what that means is that you can get the patient to treatment on average 87 minutes faster. And time is brain, so every 1 minute you go without blood flow to the brain, you lose 1.9 million neurons. And so the important thing is not only do the patients get in and out of the hospital 2.5 days faster, but they have 40% neurologic improvement when you employ this AI software. And the AI software detects it before the radiologist ever even sees the imaging. And then through a HIPAA-secured cell phone app, it transmits the findings to the entire stroke team. So these are some of the exciting ways that AI is being utilized. But yes, we are always conscientious of bias that can occur, and that's why we do these clinical validation trials.
Yeah, thank you for clarifying. It sounds like it's being used in a number of ways, and it's exciting to see where artificial intelligence will go in the healthcare sector in the future. So, Dr. Bash, thank you so much for talking with us this morning. We appreciate it.
Thank you.